Now we're going to get started on the lymphatic system. The next 3 slides are learning outcomes. I'm not going to read through each one individually due to time, but go through, read them. It tells us exactly what your goal is. Now let's begin with the basics of immunity. Pathogens are any disease-causing agent or disease-causing organisms. They include funguses, bacteria, viruses, and parasites. The lymphatic system includes cells, tissues, and organs that defend against pathogens. Lymphocytes are the primary cells. Know that, that's a test question. Immunity is the ability to resist infection and disease. There are 2 types of immunity, innate or non-specific immunity, and those do not distinguish between pathogens, and they're usually anatomical barriers and defense mechanisms. Secondly is adaptive or specific immunity, and they include lymphocytes that respond to a specific pathogen, and it's called the immune response. Four components of the lymphatic system include the lymphatic vessels or lymphatics, the lymph fluid, and then the lymphocytes, which are the specialized white blood cells. That's what we're going to focus on, and then the lymphoid tissue and lymphoid organs. We'll look at that also. Let's go over the lymphatic vessels and lymph nodes. Make sure you know that the 3 major areas, the cervical lymph nodes, the axillary lymph nodes, which are in your armpit, and that's in the greatest concentration, and the inguinal lymph nodes, which are in your groin. Now, the lymphoid tissues and organs include the tonsils, the thymus, the spleen, then the mucosa-associated lymphoid tissue, that's the MALT, and that's in the digestive, respiratory, urinary, and reproductive tracts, and the appendix. Let's go over the functions of the lymphatic system. Make sure you know function number 1. It's the production, maintenance, and distribution of lymphocytes. It also returns fluids and solutes from peripheral tissues to the bloodstream, and then it distributes hormones, nutrients, and waste products into general circulation. Now let's go over the lymphocytes. Most of the 1 trillion lymphocytes within the lymph organs are made up of 3 types. T cells make up 80%. There are a couple types of T cells: cytotoxic T cells, helper T cells, suppressor T cells, and regulatory T cells. B cells make up 10 to 15%. They include plasma cells, and they secrete antibodies or immunoglobulins. And then NK cells make up 5 to 10%, and they're called natural killer cells. Lymphopoiesis. Lymphocytes are derived from hemocytoblast cells in the red bone marrow. Some lymphoid stem cells differentiate into B cells and natural killer cells. The rest migrate to the thymus, and through thymosins trigger differentiation into T cells. Know that thymosins trigger development into T cells. In the lymph nodes, there are small non-encapsulated masses of lymphoid tissue, and there are collections referred to as mucosa-associated lymphoid tissues, or MALT. They include the tonsils, the Peyer's patches, and the appendix. The palatine tonsil, or tonsil in the palate, is the one that is usually removed and gets infected and gets the illness tonsillitis. Remember that the lymph nodes are concentrated in the neck, the armpits, and the groin. We said this previously. The armpits are called the axillary. Make sure you know that. That's where the greatest concentration of lymph nodes are. This shows you the shape of a typical lymph node, and you can see it's a kidney bean shape. The thymus is located in the mediasternum, posterior to the sternum, and it's the site of T cell production. This shows you the thymus gland above the heart, behind the sternum. The spleen is the largest collection of lymphoid tissue, and the red pulp contains a lot of red blood cells, and it filters the blood. It's located between the stomach, left kidney, and diaphragm. This shows you the location of the spleen. Now let's begin the innate or non-specific defenses. Some facts about that. Number one, they're present at birth. They don't distinguish between threats. They include the physical barriers, the phagocytotic cells, the immunological surveillance, interferons, complement, inflammation, and fever. And they provide the body with non-specific resistance. Here's a table that goes into all the non-specific defenses. Look over it. It will help you wrap your mind around these difficult concepts. Physical barriers. They provide blocking from invasive pathogens. They include the skin. Keratin is included in that. Hair acts as a barrier. Secretions from glands like the sebaceous glands in the skin flush the surface and have lysozymes. Next, mucous membranes. They have special enzymes, antibodies, and low pH. Phagocytes are the first line of cellular defense, and they engulf debris by removing cellular debris. They include microphages and macrophages. Immunological surveillance. Normal cells contain proteins that identify cells as self, called antigens. Abnormal cells have non-self or foreign antigens. NK cells recognize foreign antigens, and they secrete paraphorins and killing the cells. This is a rapid response. Here's an illustration showing you the immune response. Look over it. There are two basic types of immunity. The first type of immunity is innate or non-specific immunity. Again, that is present at birth and includes the non-specific defenses that we just went over. The second type of immunity is adaptive or specific immunity. This is not present at birth. It's acquired either passively or actively, and it's acquired either naturally or artificially. In active immunity, an individual is exposed to an antigen. The immune response occurs, and then naturally acquired active immunity happens due to an exposure to pathogens in the environment. Artificially acquired active immunity also happens when there's an antibody production stimulated through vaccines. Passive immunity is due to transfer of antibodies from another source. Naturally acquired passive immunity includes antibodies provided to a baby through a placental transfer or after birth or through breast milk. Artificially acquired passive immunity is when antibodies are injected to fight a disease or infection. Make sure you know that. These will be on the test. Look over this chart and it shows you how we have immunity, and then we have innate and adaptive. And then from adaptive, we have active immunity, naturally and artificially acquired, and passive immunity, naturally and artificially acquired. The next three slides show the adaptive defenses. Now we get the infection. Now we have cell-mediated immunity and antibody-mediated immunity. And then they both work together through direct attack and chemical attack. And they attack by circulating antibodies, which results in the destruction of the antigens, specifically the foreign antigens. Now let's talk about B cell activation and sensitization. Each B cell has a specific antibody molecule. When matching antigens appear, the antibodies will bind to engulf them, and antigens bind to class 2 MHC, causing sensitization. B cells divide into plasma cells that secrete large amounts of antibodies, or B cells will differentiate. Make sure you know that. And B cells can also have a memory B cells in reserve for a rapid second response. The next 3 slides show sensitization, activation, and division and differentiation of the B cell response. Look over table 14.1 for the classes of antibodies. They include IgG, IgM, IgA, IgE, and IgD. There are 2 responses, a primary response and a secondary response. Primary response takes time to develop. The antigen must activate the B cells, which then differentiate. Then plasma cell antibody secretion can take 1 to 2 weeks to develop. However, the secondary response has the memory B cells, and they differentiate into plasma cells when exposed a second time. They also increase in IgG, which is immediate and higher than the first response. This chart shows you the first exposure and then the second exposure, which is faster and greater. Table 14.2 shows you all the lymphocytes in your body that participate in tissue defenses. Make sure you look over them. This picture illustrates the defense against disease. You see the foreign antigen, you see the innate non-specific defenses, and then the adaptive specific defenses with both responses, cell-mediated immunity and antibody-mediated immunity, and the final result with the destruction of antigens. Autoimmune disorders. In autoimmune disorders, activated B cells begin to develop autoantibodies. Autoantibodies attack normal cells and tissues. For example, rheumatoid arthritis, insulin-dependent diabetes mellitus. Some virus-related proteins resemble normal tissue proteins. This explains neurological damages after vaccine or virus. There are certain diseases called immunodeficiency diseases. This is when the immune system fails to develop normally or the immune response is blocked somehow. AIDS is a result of the destruction of T cells. And SCID, severe combined immunodeficiency disease, infants fail to develop a cell or antibody mediated immunity. Now let's talk about immunity and aging. T cells become less responsive. Fewer cytotoxic T cells to respond to an infection. B cells become less responsive. They have slower production of antibodies, an increase in susceptibility to viral and bacterial infections, and there's also an increase in incidence of cancer due to a less effective tumor cell destruction. This last picture shows you the lymphatic system and the interactions between all the systems of the body. Make sure you look over it, and good luck on your next test.